Assalamu alaikum. My name is Shibly Faraz from MLT 8th semester, and I am presenting about sample and transportation of the sample. The main outlines are collection and transportation of sample, criteria for rejection, blood, CSF, cerebrospinal fluid, sputum, urine, stool, throat swab, and precautions. Collection and transportation of clinical specimens. Wash hands before and after the collection. Make sure that the specimen is representative of the infectious process. For example, sputum is the specimen for pneumonia and non-saliva and is adequate in quantity for the desired test to be performed. Collect or place the specimen in a sterile and appropriate container. Ensure that the outside of the specimen container is clean. Close the container tightly so that its contents do not leak during transportation. Label and date the container appropriately. Criteria for rejection of specimens. Missing or inadequate identification, insufficient quantity, specimen collected in an inappropriate container, contamination suspected, inappropriate transport or storage, unknown time delay, analyzed blood sample. Blood. Whole blood is required for bacteriological examination. Serum separated from blood is used for serological techniques. Skin antisepsis is extremely important at the time of collection of the sample. Iodine and alcohol are ideal agents. However, some individuals may be hypersensitive to iodine. Collecting blood for culture. Collect blood during the early stages of disease. Since the number of bacteria in blood is higher in the acute and early stages of disease. Collect blood during paroxysm of fever since the number of bacteria is higher at high temperature in patients with fever. Some children usually have higher number of bacteria in their blood as compared to adults, and hence less quantity of blood needs to be collected from them. Cerebrospinal fluid. Examination of CSF is an essential step in the diagnosis. Any patient with evidence of meningitis and affected cerebrum. Almost 3 to 10 ml of CSF is collected, and part of it is used for biochemical, immunological, and microscopic examination, and remaining for bacteriological and fungal examination. Precautions for CSF. Collect CSF in a screw cap sterile container and not in an injection. Do not delay transport and laboratory investigations. Transport in a transport medium if delay in processing. CSF is a precious specimen. Handle it carefully and economically. It may not be possible to get a repeat specimen. Store at 37 degrees centigrade if delay in processing. Sputum. Sputum is processed in the laboratory for investigation of bacterial and fungal infections of the lower respiratory tract. It is of utmost importance in the diagnosis of pulmonary tuberculosis. Collection of sputum. Give the patient an additional container with laboratory serial number written on it. Select a good wide mouthed sputum container. Instruct the patient to inhale deeply 2 to 3 times, cough up deeply from the chest, and spit in the sputum container by bringing it closer to the mouth. Make sure the sputum sample is of good quality. A good sputum sample is thick and sufficient in amount 2 to 3 ml. Urine. Under normal circumstances, urine is sterile. The lower part of the urethra and genitalia are normally colonized by bacteria, many of which may also cause urinary tract infection. Since urine is a good growth medium for all sorts of bacteria, proper collection is required for it. For microbiological examination, urine must be collected as clean catch midstream specimen. Urine specimens should be transported to the laboratory within 1 hour for bacteriological examination because of the continuous growth of bacteria. The feces specimen should not be contaminated with urine. Collect the specimen during the early phase of the disease. Modified Cary and Blair medium is recommended as a good transport medium. It is very stable medium and can be used for storing stool. At least 2 swabs should be inoculated. Most pathogens will survive for up to 48 hours at room temperature. Specimens are unacceptable if the medium is held for more than 1 week or if there is detectable drying of the specimen. Cary and Blair medium throat swab. Swab the inflamed area of the throat, pharynx, or tonsils with a sterile swab, taking care to collect the pus or piece of membrane. Transport in sterile transport tube. Bone marrow. Decontaminate the skin or line the site from where specimen is to be collected with 70% alcohol. Aspirate 1 ml or more of the bone marrow by sterile percutaneous aspiration. Collect in a sterile screw cap tube. Send to laboratory immediately. Transportation of specimens. A primary container which has specimen and is leak-proof with a screw cap. A secondary container which is durable, waterproof, and made of metal or plastic with a screw cap on its outside. The details of the specimen should be pasted. A tertiary container is usually made of wood or cardboard. It should be capable of withstanding the shocks and trauma of transportation. Precautions. Most specimens should be processed in the laboratory within 1 to 2 hours after collection. The laboratory must be organized to permit processing of the specimens as soon as they arrive. A continuous effort must be made in order to ensure proper collection and transportation of clinical specimens. Thank you.